Hey everybody, this is Al from Odin Medical. Today we're going to talk about supraglottic airways, specifically the King Airway. So what is a supraglottic airway? Well, for one, it's an airway device that is used to control the airway, and it's placed within the mouth, in the oral pharynx itself, which is into the mouth in the back area right here. King Airway comes in 6 different sizes. Size 0, which is for less than 5 kilograms in weight. Size 1, which is from 5 to 12 kilograms in weight. Size 2, which is for 12 to 25 kilograms in weight. Size 2.5, which is from 25 to 35 kilograms in weight. Size 3, which is from 4 feet to 5 feet tall. Size 4, which is from 5 foot tall to 6 foot tall, which is pretty much the standard that everybody kind of carries around. And then size 5, which is anything greater than 6 feet. All right, now that we have our patient, and we're going to say this is a patient that's between 5 foot tall and 6 foot tall, so we'll use the size 4 King Airway. We want to make sure that we have, number one, a patient that's indicated for use of the King Airway, having respiratory distress, some kind of respiratory issue where we need to control the airway. You need to make sure you have your suction device there so that you can suction the oral pharynx out if need be. If you do have vomit, saliva, teeth, whatever that's in there, you're going to worry about. Make sure you have your BVM. Pocket BVM works really well for us in this environment. It's compact and it works well. And you want to go ahead and set it up first. You open up the container. Comes with the BVM, the mouthpiece. Open it up. You don't need your face mask on there now because you're going to be attaching this right to the King Airway itself. In the King Airway, make sure that you have your King Airway itself. Make sure that you have a 60 milliliter syringe for your air, and then also make sure that you have your water-soluble lube. You want to make sure you lube up your King Airway so it does slide in really nice into the mouth. So you also want to make sure, as in any airway device, that the balloons work. So you want to go up to 60 milliliters of air. Now, this particular balloons will go to between 60 to 80 milliliters of air. We do not want to go above 60 because of the pressure issues that you have with the intercranial pressures. It decreases the amount of blood return because of the compression on the inside. But that's a whole other story. Right now, just worry about 60 milliliters is all you really need to go into there. So you want to go ahead and fill it up through the pilot balloon. Make sure that your balloons work and they don't decrease in size, which they do work, and they're not deflating. If they do deflate, you cannot use it, and you need to get a new King Airway. So pull the air back out again. Get your syringe ready beside you. Suction the airway if you need be. Go ahead and grab your King Airway like this, with in between the fingers like you're holding a pencil, thumb over the top, on a side on the angle. Reach into the patient's mouth. Now I'm going to hear it already. You're going to say, oh my gosh, you're putting your thumb into the patient's mouth. You're going to bite your thumb off. The reality is, if they need a King Airway, they can't have a gag reflex, and if they can't have a gag reflex, they're not going to bite your thumb off. It's just not going to work. So you put the tip of the King Airway on the side of the mouth or the corner, all the way in past the big balloon, past the teeth, at which time you rotate it to where this blue line, which is right here, is facing towards the chest. And then you just shove it all the way in until the red hub here reaches the teeth. Then fill up your balloons with that 60 milliliters of air. You know it's worked well because the pilot balloon will be full. Immediately remove it with holding pressure onto the syringe itself, because if you don't, back pressure will pull it back in and you'll lose the seal and it won't work as well. Go ahead and pull it and snug it into place. Attach your BVM and bag. You'll see the chest is rising and you have an airway. The King is simple, it is fast, and it works very well. Now that you have it in place, you need to secure it. Understand that the King Airway is designed not to have a secure device on there because of the placement of it. What I found through experience is that you do need to have some form of device on here, whether it is going to be a endo-lock ET tube holder or some type of tape or some type of IV tubing or something along the lines, you want to make sure you just secure it around the same way you would as an ET tube. So the one thing I understand about supraglottic airways is that there's Kings out there, there's iGels. It doesn't really matter what you're using so long as you know how to use the piece of equipment that you have. We're just demonstrating one specific kind. One of the things I also want to point out to this, you might see that I was wearing my gloves during this actual training video. One of the things I really stress is that you wear what gloves you would wear during operations so that you get used to the dexterity and the way it feels. If you don't train like that, when it comes down to the real world, then you're going to have an issue because it won't feel the same and you'll have a hard time with it. Not that you won't do it, it'll just be difficult to do. All right, again, my name is Alf. I'm with Odin Medical. Please hit us up if you have any education or teaching options or questions at odinmedical.com. Have a great day.